Our lab today includes the subject of urinary bladder and male internal genital organs. This sample shows the urinary bladder. It is conical with an apex and a base. It has superior surface and two lateral surface and posterior surface, which is the base. This part of the urinary bladder is called the neck, while this part is called the apex. Below the neck is the prostate gland in male. And in female, below the neck of urinary bladder is the pelvic diaphragm. So, returning back to the urinary bladder, the inside of the urinary bladder is showing regular folds, except for the lower part of the base, which is the posterior wall. This part must be smooth, showing a triangular smooth area, which is called the trigon. The apex of the urinary bladder, as shown in this sample, this is the apex of the urinary bladder, is connected by the median umbilical ligament, or which is called the urachus, that is covered by the peritoneum, covering the urachus, which is called median umbilical ligament. So the apex is connected by fibrous tissue, which is the urachus, to the umbilicus, while the base posteriorly is related to the rectum. This is in male. In female, the base of urinary bladder is related posteriorly to the vagina and the lower part of the uterus, which is the cervix of the uterus. So the apex is connected by the urachus to the umbilicus. The base is related posteriorly to the vagina and to the cervix of the uterus in female, while it is posteriorly, the urinary bladder is related to the rectum, separated from it by the vesical pouch. On the sides, the urinary bladder is related to levator ani. You can see here the position of the urinary bladder, which is removed. Here you can see this position is related to the levator ani muscle. And also anteriorly it is related to the pubis. The features that have been described now will be explained shortly on the cadaver, on the sample. And just try to look on the cursor of the computer. This is a complete urinary bladder. This is the apex of it, while this is the back of it, the posterior aspect. And this is the sides, the lateral walls of it. Posteriorly, you can see that the urinary bladder is related to this structure, which is bilateral here and here. These are the seminal vesicles. This is a seminal vesicle, and this is a seminal vesicle. The seminal vesicles are lobes related to the male internal genital organ. They add secretion to the seminal fluids, and medial to them, behind the urinary bladder, this structure, is the ampulla of vas deferens on that side and that side. So the back or the base of the urinary bladder is related to the bilateral seminal vesicles and the bilateral ampulla of the vas deferens. The ampulla of the vas deferens and the duct of the seminal vesicles unite here to form the ejaculatory duct that enter into the prostate, opening into the prostatic urethra. So this is the prostate, and you can look to it here from lateral aspect also. This is the prostate, and this is the urinary bladder. Of course, as we said, this is the ampulla, and this is the seminal vesicle. What is this? This is the ureter. This is the ureter. And you can see how the ureter passing into the back or the base of the urinary bladder. So we will open the inside of the urinary bladder. The inside of the urinary bladder shows many foldings, irregular folding of the mucosa. And posteriorly, in the lower part, you may see the trigon, the smooth region. It's not so clear here because we are opening an incision into urinary bladder. That's why we did a half urinary bladder section, which is this one. This half urinary bladder section shows also an apex, which is here, superior surface, and this is the base, of course, and from that side is the lateral surface. And this sample had been prepared in order to show the back of the mucosa. Although it is not so clear here, but this is the back of the mucosa of the urinary bladder. And if you look to it closely, you can see this region, the lower part of the back, is smooth, forming the trigon. The trigon has an apex below and two lateral angles, and this lateral angle shows the opening of the ureter. You must look to this in a close view. This is the trigon, the lower part of the mucosa posteriorly, smooth trigon. Of course, posteriorly in this sample, this is the seminal vesicle, and that is remnant of the ampulla of the vase, and this is the ureter. You can see how long is the ureter here. This is all about the urinary bladder. Going back to the male internal genital organ, because we had discussed the bladder in male and female. The male internal genital organ includes the prostate, seminal vesicles. Some textbooks include the vas and the testis also as a male internal genital organ. But because, according to our curriculum, the testis and the vas are included in the subject of the abdomen, we will cover now the prostate only. The prostate is a conical organ with an apex below and a base above. The base is directly related to the neck of urinary bladder. The neck of urinary bladder shows the opening of the urethra, which is called internal urethral orifice, that is surrounded by the internal urethral sphincter. And this neck is related to the urinary, to the prostate, the base of the prostate, and inside of the prostate you can see the prostatic urethra. And at the apex of the prostatic urethra, at the apex of the prostate, the prostatic urethra projects inside the urogenital diaphragm to form the membranous urethra, after which the urethra passes into the bulb of the penis to form the bulbar urethra. So the urethra is three parts: prostatic urethra inside the prostate, membranous urethra in the urogenital diaphragm, and bulbar urethra in the penis. You can see that the prostatic urethra shows a small diverticulum that enters into it. This is called the utricle. It is the synonym of the uterus in male and female. In female you have uterus. In male you have this structure, which is not called uterus, it is called utricle. That is a synonym of the embryological structure in embryo. And on the side of this utricle, you may see the ejaculatory ducts on the right and left side, but actually you cannot see it in this sample because this is a mid-section. So it will not show the ejaculatory ducts on the sides. I have to remove this utricle in order to see on the side of it the ejaculatory duct. And I will repeat what is the ejaculatory duct. The back of urinary bladder shows two seminal vesicles, and medial to them ampulla of the vas. The ampulla of the vas and the seminal vesicles form ejaculatory ducts that pass into the prostate, which is this is the prostate. So the ejaculatory ducts formed of union of the seminal vesicles and the vase open into the prostatic urethra on the side of the utricle. We will get use of the ejaculatory ducts and the utricle and the prostatic urethra to divide the prostate into 5 lobes. The part of the prostate in front of the prostatic urethra, this is the anterior lobe of the prostate, while the part of the prostate behind the utricle, and of course it is behind the ejaculatory duct, and behind the lower part of the prostatic urethra is the posterior lobe of the prostate. So this is the anterior lobe and this is the posterior lobe, behind the ejaculatory duct and utricle and behind the lower part of the urethra. And this part between the utricle and ejaculatory duct and the upper part of the prostatic urethra is called the median lobe of the prostate. So now we have anterior, posterior, and median lobe. And laterally we have right and left lateral lobes, so these are 5 lobes of the prostate. This median lobe is very important because most usually it is involved in benign prostatic hypertrophy. And because of its position, it normally produces an elevation in the lower part of the trigon. You remember the back of the mucosa of the renal bladder, in its lower part is a smooth trigon, which is mucosa. The lower part of the trigon is elevated normally by the median lobe of the prostate, which is called uvula vesicles. But when the prostate is enlarged, and especially adenoma occurs in the median lobe, this uvula vesicles will enlarge much that because of the underlying median lobe. And that's why it will close the internal urethral orifice, and that's why the bladder will be closed and the patient will not be able to urinate, resulting in retention of urine, and you have to introduce catheter into the bulbar urethra and membranous urethra, prostatic urethra, and then to the urinary bladder to make the patient urinate, because the internal urethral sphincter will be closed due to tumor, which is hypertrophy of the median lobe, closing the internal urethral orifice by enlargement of the uvula vesicles at the lower part of the trigon. Mostly, these are the topics of our lecture today. I don't have any more. In regard to the urinary bladder and in regard to the male internal genital organ. Of course, I will not consider the testis, epididymis, and the vase because they are with the subject of the abdomen. But here, I can revise to you something. What is this? This is the vase. Let us follow the vase. The vase begins at the lower end of the epididymis, right? It is the same continuation of the epididymis. And the vase will ascend on the medial side of the testis, and then the vase will pass into the cord, into the spermatic cord. Then the vase will pass into the superficial inguinal ring. So the vase will run in the inguinal canal. And then the vase will pass into the deep inguinal ring, and it will enter here into the abdomen. This is the vase. This is the vase exiting out of the deep inguinal ring. Then, when the vase deferens exits out of the deep inguinal ring, it will turn medially on the lateral side of the inferior epigastric vessels. These are the inferior epigastric vessels, and this is the vase exit out of the deep inguinal ring, and it's turning on the lateral side of these inferior epigastric vessels, crossing the external iliac arteries, and reaching to the back of urinary bladder. When the vase reaches the back of urinary bladder, of course, just look to the cursor. This is the vase on the back of urinary bladder. We said that the vase on the back of urinary bladder will be dilated to form the ampulla of the vase. This ampulla is just medial to the seminal vesicles. Both of these, the ampulla and the seminal vesicles, are behind the urinary bladder. And then the ampulla of vas and the duct of seminal vesicle unite to form the ejaculatory duct that opens into the prostate. This is the prostate, right? And this is another view. Of course, this is the ureter. This is the ampulla of the vas. This is the seminal vesicle. This is the prostate gland, right? This is the urinary bladder. There are so much details in regard to relations of the prostate. The prostate is related anteriorly to the pubic symphysis, and there are fat between them, connected to them two bipubovasacal ligaments, and the prostate is related posteriorly to the rectum and upper part of the anal canal. That's why if you want to examine the size of the prostate, you may introduce PR exam, PR rectus exam, and you can feel the prostate from the anus and upper rectum by PR, because posteriorly the prostate is related to the upper part of anal canal and the lower part of the rectum. On the sides also the prostate is related to the levator, and of course you have levator prostati, part of puborectalis, if you remember. This is all about the subject. I hope that I'm covering everything, and thank you.